Hey guys, welcome to our channel. Let me give you a brief introduction to cephalosporins. This group of drugs grouped under beta-lactam antibiotics. Their mechanism of action is cellular synthesis inhibitor, which blocks the cross-linking of peptidoglycan chains, which is the final step in bacterial cellular synthesis. As you know, uh, the cell of bacteria is the most important component for the survival of bacteria. So these drugs works by inhibiting the cell wall and consequently the bacterial survival will be affected. These drugs organized into 5 generations. Each generation generally shifts its balance of gram-positive versus gram-negative coverage and beta-lactam stability. In simple terms, the early generations like the first are more effective against gram-positive cocci, while later generations expand their reach to gram-negative organisms, with fifth generation even targeting some resistant strains like MRSA or methicillin-resistant staphylococcus. Here is a breakdown of generations along with some common mnemonics to remember their names easily. Let's come to first generation, which is characterized by strong activity against gram-positive bacteria and limited coverage of gram-negatives. Examples: cephalexin, cefazolin, and cephalotin. Mnemonic: think A for alpha, which is the beginning. Tip: many first-generation cephalosporins have an A immediately after ceph. For example, cephalexin and cefazolin, signaling they are from the starting line of cephalosporins, which means indicating first generation. Remember, cefaclor is an exception, even though it might sound similar. Second generation, characterized by enhanced activity against certain gram-negative organisms in addition to gram-positives, which have two subgroups, subgroup A and subgroup B. Subgroup A, subgroup with activity against Haemophilus influenza or H. influenza, for example, sulfurexin. Subgroup B, cefamycin subgroup with activity against bacteroid species, cefoxitin and cefotetan. For example, cefuroxime, cefoxitin, cefotetan, cefmandol, and cefmetazole. Mnemonic: remember 4E, Fox, 4, Phone, T, and 2 M's. Breakdown: 4, which indicates cefuroxime; Fox, which indicates cefoxitin. Since there is 4, there is Fox. This word is found in the name of the drug. 4E, Fox, Phone, 4 Phone, T, and M's, which are mnemonics found in the middle and the beginning of the drugs. So 4 cefuroxime, Fox, cefoxitin, Phone, T, cefotetan, and 2 M's, cefmandol and cefmetazole. So you can easily remember this the drug names easily. Third generation, again, it has two subgroups, subgroup A and subgroup B. Subgroup A with broad gram-negative activity but poor activity against Pseudomonas aeruginosa, for example, cefotaxime and ceftriaxone. Subgroup B, subgroup with broad gram-negative activity, including good activity against Pseudomonas aeruginosa, for example, ceftazidime. So, if you suspect a patient with Pseudomonas aeruginosa, patients with pneumonia, patients with meningitis, or any systemic infections, if you suspect or if you find Pseudomonas aeruginosa by blood culture or a clinical suspicion, you can it is better to administer ceftazidime. So it is characterized by better gram-negative coverage and improved central nervous system penetration, and often used in serious systemic infections. Third generation example: cefotaxime, ceftriaxone, ceftazidime. Note that cefuroxime, despite its it is eczema, ends with eczema, ending it is second generation. So all drugs with ending of them is not a third generation. Most third generation names ends in MA. If you catch cephalosporin ending in MA, like cefotaxime, ceftriaxone, or ceftazidime, think of third generation, keeping in mind that the exception of cefuroxime, which is second generation, despite the similar naming. Let's see fourth generation, which is characterized by broader gram-negative coverage with increased resistance to beta-lactamases. Cefepime has activity similar to that of cefotaxime and ceftriaxone against pneumococci, including penicillin intermediate strains and penicillin-sensitive staph aureus. For example, cefepime is a primary representative in this group in fourth generation cephalosporin, and it has greater activity against gram-negative enterics. Okay, let's see the last generation, the fifth generation cephalosporin, which is characterized by expanded activity that now can include methicillin-resistant staph aureus coverage with broad gram-negative activity. Example, ceftobiprole, ceftaroline, or ceftolazine. Sorry. It is all about RO and LO. Let's break down it. RO, ceftobiprole, ceftaroline, you can find RO here and RO here. So RO indicates fifth generation cephalosporin, and LO, ceftolazine, you can find LO here. So if you find RO and LO among cephalosporins, it indicates fifth generation. So this clear RO LO sound in the names immediately suggests the fifth generation cephalosporin. So finally, let's see common indications of cephalosporins. Skin and soft tissue infections, first and second generation cephalosporins like cephalexin, cefazoline are often used to treat uncomplicated skin infections like cellulitis, skin abscess, and wound infections, as well as for surgical prophylaxis. The other respiratory tract infection, several cephalosporins, especially from the first and third generations, used for community-acquired pneumonia, bronchitis, and other upper or lower respiratory tract infections. The other UTI or urinary tract infections, second and third generation agents like cefuroxime or ceftriaxone are used to treat urinary tract infections, offering good coverage against many gram-negative bacteria that are common in these infections. The other ear infections, sinusitis, and meningitis. Certain cephalosporins, ceftriaxone, cefotaxime, prepared for their efficacy in treating otitis media, sinusitis, even meningitis due to their good central nerve system penetration. The other bone and joint infections, when bacteria are known or suspected to be susceptible, cephalosporins can be given for osteomyelitis and septic arthritis. Note that the specific generation chosen often depends on the suspected pathogen, its resistance profile, and the severity of infections.